Thank you very much, Mr. Chair. Welcome, everybody. Special welcome to Professor Nick Smiar. As Alvin already alluded to, the time difference, it's very early in the morning over there. Unless you've worked night shift now tonight, you will not understand getting up 3 o'clock in the morning, which is a huge sacrifice. Nick Smiar is a lifetime member of the NACCW and has been coming to South Africa for many years, more than 38 years. He has been a childcare worker for about 58 years and a social worker for roughly 55 years. He worked in residential treatment, day treatment, psychiatric hospitals, emergency community response services, mental health settings, and therapeutic foster care. He's been a frontline childcare worker, a childcare supervisor, a clinical child therapist and supervisor, and of course, executive director and a board member. His bachelor's degree is in classical languages, and you often hear when Nick is in South Africa, he attempts to speak amongst others Zulu, Xhosa, a little bit of Sesotho as well, and he will tell you how many other languages he has mastered over the years. His first master's degree is in theology and in church history, and PhD candidacy at the time from the Divinity School of the University of Chicago. His second master's degree is an MSW in psychiatric social work and a PhD in social welfare policy from the Jane Addams College of Social Work at the University of Illinois at Chicago. Professor Nick is a professor emeritus of social work at the University of Wisconsin-Eau Claire. He taught at university for more than 20 years. In his retirement, he is an elected official as a county board supervisor in his home country. He also works in Germany, Austria, Finland, the Netherlands, Croatia, and Serbia. And again, when he goes there, he tries to speak their language to try and teach them in their mother tongue, doing training of childcare personnel who work with potentially violent clients. Professor Nick has made valuable contributions over many years at the NACCW national and regional conferences. And for many years, he traveled to this country. He also offered his expertise at workshops and training sessions on numerous topics. Today, he will once again speak on a topic that is so pertinent to us in the child and youth care field, because it speaks to the real challenges we are facing. So please join me in welcoming Professor Nick Smiar. Welcome, Nick.
Thank you. Sanibonan, mulweni dumalang, before ito nani posis. Yabong gizama ukufunda isiZulu. Goedemorgen, dames en heren. Ik praat en verstaan Afrikaans ook.
Goedemorgen.
Ik praat Afrikaans niet goed, niet. So, good morning, everyone. Thank you, Francisco. I'm very excited to have this opportunity. I was in South Africa about a month ago, but only briefly. And so I appreciate the opportunity to connect with all of you. I was saying to Francisco that I was trying to remember how many people I know in South Africa, and I lost count. I absolutely can't remember everyone. This topic, I can't remember who proposed it, whether it was me or Zenny or who it was, but I'd like to make a couple of comments about the topic. We work in what I consider a high stress environment. We work with children with various needs and problems and so on. And we deal not only with the children, but with their families, their relatives, the public Department of Social Development. It's a very high stress environment. And it's very, very easy for us to lose track of how much of our energy goes into that and the impact of that on our lives. So I want to talk today certainly about burnout, what that means for the individual and so on. But I also want to talk about what responsibilities we have in regard to burnout, not only as individuals, but as supervisors in regard to our team, as administrators in regard to our agency, and so on. So we think about it more broadly because it isn't just the individual working on burnout. The structure around the person has to be set up in such a way that it takes into account these stresses and provides supports and assistance. So I want to talk about it more broadly than just the individual. So Zenny, can you put up the PowerPoint?
Sure. Can we have the
Thank you.
PowerPoint up, please?
Okay. And so who do I yell at to change the slide? Who's in charge of that?
You can,
Randy.
yeah, that's me.
Randy.
Okay. All right. Change the slide. Thank you. So I want to be careful as we're going through because some people use the phrase burnout or the word burnout very broadly to refer to any stress level, any exhaustion. But we're talking today about a syndrome, a gathering of characteristics. It's a prolonged state of physical and mental exhaustion, usually due to long-term exposure to a high-pressure atmosphere, and I would add, without safeguards. So we're talking about a particular syndrome, not just being tired. I can remember many days when at the end of the day I was exhausted, but that's not burnout, that's simply exhaustion. So let's talk about what burnout is not. Next slide. So when we talk about burnout, we're talking about instances in which people become cynical or they're depersonalized. They begin to lose their personal touch and commitment. They're discouraged and have a low sense of efficacy of the impact that they're having with their work. It's much more difficult to address than being just tired because you schedule work shifts badly. And we've all been guilty of that, of overworking. Let's go to the next slide. Okay. So I ask this question all the time, and people struggle with this. We use the phrase burnout all the time, and I ask the question, what's burned out? And people say, well, the person. No, the person is not burned out. Think about this very carefully. What's burned out is the motivation and commitment to the job. If you think about that, you realize not only is that very significant, but it's a safety factor and it's a health factor. And the signs of this burnout, the syndrome, are low energy, constantly tired, passive-aggressive behavior. I've always been fascinated by passive-aggressive behavior. Passive-aggressive behavior is behavior in which I'm being aggressive, but I'm not taking responsibility for it. I'll be passive about my own aggression. And so the burned out person will project that burnout onto other persons and somehow or other hold them accountable for it, when actually the individual does have a high accountability for it. I can't do that now, but in a workshop, sometimes when I illustrate this, I'll turn to somebody and I'll look at the person right in the face and say, it's really warm in here. It'd be good if someone would open the door. And when the person stands up to open the door, I say, what are you doing? And the person will say, well, you said to open the door. I said, no, I didn't. That's passive aggressive behavior. Avoidance of accountability or responsibility. There's so much pressure on performance that the burned out person does not, it tries to avoid accepting any responsibility for it. Probably most important, in my opinion, the most important sign is a failure to follow the best standards of practice, which are contained in our code of ethics. So we're not talking about doing the minimum. We're not talking about just stumbling through what you're doing. We're talking about the best standards of practice. So, for example, when you go to the doctor and you say, well, doc, I have this growth on my neck. And the doctor says, well, I want you to stand on one foot and jump up and down and cluck like a chicken. You're going to say, I don't think that's best standard of practice. We expect of a doctor always the best standard of practice. And it is the same for us as childcare workers. And finally, and most dangerous, is the overreaction or underreaction in volatile situations. And I'm going to talk about this in more detail a little bit later. You cannot predict what the burnout person will do in the volatile, in the dramatic situation, because the ties the person has to the code of ethics, to standards of conduct, to the agency, to his fellow workers, is not there. And so a person becomes overreacts or underreacts. I found a very interesting cultural observation here for Americans and for South Africans. We have no trouble talking about overreaction. None. We can talk about hitting people and yelling and throwing things and so on. We don't talk about underreaction. That is withdrawing, not doing anything, just looking helpless. So these are all signs of the burnout of motivation and commitment. You know, when we came into the field, well, I'll speak for myself, but I think I share this with all of you. At first, I stumbled into childcare work in 1966. Someone said to me, "You should work as a childcare worker." I said, "Oh no, I don't think so. I think the children will hate me, and it's not going to be good." Well, then I wound up doing it. I took the job, and for about 6 months, every morning I would get up and look in the mirror and say, "What the hell are you doing?" You know. But after 6 months, I said, "You know, I think I can do this, and I think I can do a good job at this." So the motivation and the commitment is what keeps us going. That's why this discussion of burnout is so important. We're talking about resources, human resources, ourselves, our co-workers, in terms of the agency, the resources that the agency has to do its work. We're talking about the willingness and the enthusiasm and the interest in doing the work. Next slide. So what is that does burnout motivation and commitment? Well, I'm going to give a couple little, not little, but a couple major factors here, but we'll talk more about them. First of all, continuous and unmanaged stress. Continuous meaning there's not a pause, it's just ongoing, every day, all day long, all through the work time. And unmanaged means unmanaged not only by the individual, but frankly, it's also unmanaged by the environment, by the supervisor, by the team, by the agency. Second, a lack of training in and practice in self-care. Now, I've been in the field long enough, I can remember when these things came to the forefront of discussion. Self-care. Many years ago, in my agency, we decided that we would do some work on our philosophy, our way of operating. And one of the things that we came up with, one of the phrases was, we take care of ourselves so that we can take care of others. And when you unpack that, that means we practice self-care. We pay attention to taking care of ourselves and not burning ourselves out trying to take care of very difficult children. The third factor is a poor self-assessment of performance. We get in the middle of this, tough days, long hours, and so on, and we actually are probably doing a pretty good job, but there's a sort of a depressive factor there. We start thinking, I didn't do so well today, and this happened, and I'm not such a good worker, and I'm failing at what I'm doing, and we're very hard on ourselves. And that contributes to burnout. Fourth is a failure in team support. This doesn't happen in isolation. I don't become burned out off on my own somewhere. I'm in the middle of a group, and I'm in the middle of co-workers and so on, who should be supporting each other. We should be. I'm sorry. I thought someone was speaking. So, sorry, I lost track of myself there. Oh, so if there's a failure in the team to provide mutual assistance, just simply saying, I see you're having a tough day, or let me help with this, or that sort of thing. If there's a failure there, that contributes to burnout. And finally, the absence of or the presence of poor supervision. And we've had many discussions in NACCW about supervision, and we still do. I just did some workshops in Durban on supervision. Supervision is supposed to be not just a teaching modality, but it's supposed to be a supportive and professional development activity. So if supervision in that sense is not taking place, that contributes to burnout. So we have quite a few factors to pay attention to here. Next slide. Thank you. It's always risky to talk about stages, but burnout doesn't just suddenly happen overnight. There's a, I'll call it a slide into it, a slide down into it. And this is not a comprehensive description. This comes from Fredenberg and North's work on burnout. Burnout, by the way, became a focus back in the 1970s. The term was not used prior to probably 1972 or so. And so Fredenberg and North did a study in the 86, how burnout develops. So this is not a hard and fast description, but it's helpful. Beginning with compulsion to prove oneself. So I'm in a tough situation. I'm working with difficult kids. I'm working in some difficult occasion, and I want to make sure that I do a good job. And I have compulsion to prove myself. So then I work harder, and I work harder, and I work harder. And third, while I'm working harder, I have to be neglecting other needs that I have. I'm so focused on proving myself that I neglect my own needs for such simple things as rest, food, positive feedback, support, training. And because these needs are neglected, I begin to displace conflicts. I have conflicts, but I'm assigning the reason for the conflict to other things. And that leads to a revision of my values. I start realigning values. And that leads to a denial of emerging problems. I start saying to myself, well, no, that's really not, that really isn't happening. Because if I acknowledge an emerging problem, I have to acknowledge that I'm not doing my job. And the consequence of that is that, sorry, my screen is acting up there. I begin to withdraw. Withdraw means, it may not be physical, it may be emotional, but I begin to withdraw from the group, become more, I would say, psychologically isolated, which leads to odd behavioral changes. I start doing things I would not have done before. That leads to depersonalization. In other words, I'm not dealing with, for example, the children in front of me as unique and individual persons. And I experience my own inner emptiness, my depression, and that leads to the full syndrome. And you'll notice on the slide, the red letters there. When you come to depersonalization, this is now a time when you really should be considering some kind of medical attention, because you're dealing with your charges, the children, not as persons, but as objects or things or external considerations. The inner emptiness is an emptiness of, it's not just a feeling of emptiness, it's the lack of resources and strength and so on. Should also consider medical attention. Depression you should strongly consider depressed. We don't want to have depressed people working with the children that we're dealing with. And finally, if you're in burnout, you seek medical attention immediately. You get help immediately, not waiting. Next slide. So here we come to one of the, I think, principal points. The burned out child care worker can be a dangerous person in the environment because the child care worker is likely to overreact or underreact in a volatile situation. That person has lost connection to the code of ethics, to training, to intervention skills and procedures, and even with fellow team members. So very often when I talk about this in workshops, I'll say, no, I want you to imagine, think of the worst person, the worst child care worker you have ever worked with, ever, in your whole career. That person is standing next to you right now. And right in front of you, there is a terrible situation happening. Some children are being violent with each other and so on. My question is, what is that person doing? What is that person doing? The answer is either nothing, withdrawal, or overreacting. Now I want you to imagine the best child care worker with whom you have ever worked in your whole career. That person is standing next to you. That situation happens. What is that person doing? That person is doing what he or she should be doing and what the training taught the person to do, and the person does it and does it almost automatically. So I don't want to be over dramatic about this, but burnout can lead to some very dangerous situations if it's not handled in regard to the individual child care worker. Some of you are familiar with the PART training, and I've done PART training with some of you. That was the basis of the PART training. The assumption that if a person is trained in the ability to manage his or her emotions and so on, then that person becomes less of a risk in the volatile situation. So keep in mind that burnout has a very practical, real, and safety aspect to it. Next slide. So we talked about some of the symptoms of burnout. One of the main symptoms is detachment or depersonalization. We stop considering the person we're dealing with as a person. It's common in healthcare fields because we're constantly facing dilemmas. What should I do here? What's the right thing? And after a while, it becomes almost routine that what we do. And we stop considering the individual person in front of us and start thinking of the person as just another example of a pattern. But the reasons go much deeper. People dealing with burnout feel hopeless in their situation, as if there's no light at the end of a tunnel. And if you feel hopeless in any situation where you feel hopeless, you start reaching out for anything you can grab onto. And often enough, this causes cynicism, emotional depersonalization, lack of interest in others, sarcasm, deteriorating interpersonal skills. You start hearing yourself or your colleagues making really negative statements about the children. You know, I'm going to be really vulgar here, with apologies, but when you hear your colleagues say, well, we got another day of working with the little assholes, that is a sign that there is something happening there, depersonalization and possibly burnout. It's the detachment from person. Next slide. This all sounds really depressing, doesn't it? Chronic fatigue is another symptom of burnout. Feeling tired after a long day of work, that's normal. I can remember long days of work. My first group, I've told this story many times. My first group were 5- and 6-year-old children. I had 7 of them. And by the end of the day, I was so wiped out, I could hardly stand up. But Chronic exhaustion, that is not the exhaustion that's brought on by the actual physical labor of the day, but an exhaustion that comes from the constant exposure to that. That's a mental struggle as well as a physical one. I feel physically tired, exhausted, but I'm also mentally exhausted, which means that I don't have the mental strength to reach out and grab onto the training that I have, the code of ethics and so on. It feels as if I'm just doing the same old thing automatically. And that will lead eventually, as we say here, to a lack of personal fulfillment. We do the work we do, frankly, because we get something out of it. And when you're burned out, you're not getting anything out of the job. Now, the people who work, for example, with autistic children will often say, you have to celebrate the really tiny things, the tiny things that they accomplish. These are great things. And if those things are there, if you can see the effects of the work that you're doing, even if they're tiny, that's very fulfilling. However, if you're going automatically through your day and just doing your job as a routine sort of thing, and you lack that personal attachment, and you experience a chronic fatigue, you are in a state of burnout. And all of this is close with the next symptom. Next slide. And this is what I'm talking about, the lack of accomplishment. I can remember as a childcare worker many years ago, working with really difficult kids, really difficult, for months on end, 6 months, a year, whatever. And at the end of that 6 months or year, I could see a change. And I'm not saying I caused it, but I could look at it and say, I think I had a part in that. I did something there. I had a sense of accomplishment. If I don't ever have that sense that my work is having some kind of impact, that leads to burnout. So despite devoting a large amount of energy and time, the burnout employee will often feel obsolete, replaceable, unvalued. Nobody likes what I'm doing. I'm not doing a good job. Poor me. It affects productivity, satisfaction, overall job performance, not just of the individual, but of everyone in the group. So do we work with difficult children? Yes, we do. Do those children always have success? No, they don't. Do they have minor successes? Yeah, they do. They do. They do. So that if that sense of accomplishment is not there or cannot be there, that leads to burnout. It's a symptom that the person feels as if he or she is not being effective. Next slide. Okay. Physical consequences of the burnout syndrome. The burnout syndrome is harmful to the physical health of workers, not just the mental health. A weakened immune system is caused by stress and anxiety. And that means increased susceptibility to viral illnesses, exhaustion, and behavioral problems. We're talking about the staff, not the children here. There's a weakened immune system. I think this is common knowledge. People know if my immune system becomes weak, I'm open to catching a cold or a virus, or to changes in my behavior and so on. The anxiety symptoms, you have anxiety symptoms such as chest pains, muscle spasms, heart palpitations, and probably most common, headaches. Also insomnia, or restlessness. I remember many days after a long day's work with some really difficult kids, I could not go to sleep. I could not. Inability to focus on a given task. There's so much racing through my head that I can't concentrate on what's in front of me. So these symptoms occur quite commonly in the work that we do, and we deal with them. Ordinarily, we deal with them. But when they become worse, when they become more frequent, when they become more insistent or consistent, the individual should consult a medical professional, should seek help. And that's a hard thing for most people, and especially for us as helpers, to say, I need help. Next slide. The psychological consequences of burnout can be even worse than the physical ones, especially in the healthcare field or the childcare field that we're in. Ethical dilemmas, traumatic experiences can leave doctors and nurses and childcare workers with PTSD or post-traumatic stress disorder. I'll recall a particular instance in my own experience. This was in the psychiatric hospital. I was working with young adult patients, and it's a long story, but the gist of the story is I was struck in the head by a chair. One of the patients was having a LSD flashback, and I was sitting talking to another patient, and he came up behind me and struck me in my head with a chair. That is a traumatic experience, obviously one which I never forgot. So we all have stories like that. People in these fields that we're talking about sometimes experience suicidal ideation, as if to say, well, what's the use of life if this is what's going to happen? Some studies link burnout to the development of depression and anxiety as well. So there's this lack of emotional connection and feelings of anger that will surface and affect interpersonal relationships, not just with the children we deal with, but with our coworkers and possibly also with our spouses and significant others. So the psychological consequences of burnout are not just confined to what I'm experiencing in my work with the children. It extends to my whole life. Next slide. So let's get very practical here. I'm going to slow down a little bit now too. So this is a handy dandy little checklist. And again, it's not hard and fast. It's intended to be useful. So I'm going to go through these one by one. Personally, I hate to be read to, but I'm going to do that to you. I'm going to ask you, I think I can ask you for your feedback or comments as we go through this. So let me refresh your memory here. You can put a comment into the chat, or you can raise your hand. As those of you who know me know I want to interact with you. I don't want to just be a one-sided conversation here. So as we go through, if you have comments, I would love to hear them. So let's take them one at a time. Do you question the value of your work? What difference does it make what I do here in this moment with this child? Who cares? Who will know? And so on. The work that we do is actually, my mental image is, it's a lot like throwing a rock into a calm pond. So we throw the rock in, and you can see it go into the water, but then you see those concentric circles coming out. And we never know what the concentric circles are in the work that we do. We know the intervention that we did, but we don't know what came of that. And so the question is, do you question the value of your work? And is what I'm doing valued by me and by others? And does it make a difference? And often, day to day, the answer might often be, well, in this particular instance, no. But over the long run, yes. Do you drag yourself to work and have trouble getting started? If you get up in the morning and you say, I don't want to go to work, I hate it. I can't face myself. I can't face these children. And you have trouble getting started in the work. There is a problem. You don't have to be leaping out of bed and saying, oh, I can't wait to get to working with these difficult children. But there has to be something that keeps you coming to the work. I said to you that I told you my story about looking in the mirror for 6 months. That was my way of dragging myself to work for the first 6 months, because it was so difficult. But once I could find myself in it, once I could find my competence, once I felt that I really was doing something, that changed. Do you feel removed from your work and the people you work with? Do you feel distant from them? That you don't share their perspective, their opinions, their experiences, and so on. Sorry, I'm looking at my screen. Do we have any comment, any chat?
No comments yet, Nick.
Okay, I'll see if I can stir up something. All right. Have you lost patience with coworkers, customers, or clients? The work that we do it's complicated, it's stressful, and it takes a long time to effect change. And this always bothered me. We'd get the referral of a child who's just in terrible shape. And the child is there for 2 weeks, and the State Department is saying to us, "So, what are you doing? Why haven't you fixed him?" And so it's quite easy to lose patience with the job, with our coworkers, with the children we work with. Why can't they understand this? How many times do I have to say this? Do you lack energy to do your job well? Not do your job well. Do you lack the energy? And if we're working with troubled children, they suck up a lot of energy, because you always have to be paying attention. One of the things I stress when I talk about the activities of a worker is that you are always assessing the group and the individual. Always. You can't stop. That's a lot of energy. Do you have the energy to do your job? Is it hard to focus on your job? Are there distractions? Are there practical reasons why you can't maintain a focus? Do you get little satisfaction from what you did? It's okay at the end of the day to say, "Oh, that was a great day. I feel good because I did this one little thing," or I'd love to tell stories. You know that. So one day I walked up onto one of our units, and the staff were all standing at the end of the hallway looking out the window. I said, "What are you doing?" And they said, "Johnny's running away." And I said, "He's running away? You should be doing something." He said, "Yes, we are. We're cheering for him because it's the first time he's actually made a decision to do something for himself," which I thought was a very odd sort of thing. But the staff were satisfied. That what struck me was that they were excited for him, that he had actually made a decision. He was kind of a nebbishy little kid who was always the object of bullying from other kids and so on. And he actually made a decision and then did something himself. And the satisfaction that staff showed and that little thing, I thought was so interesting. We need to have those little satisfactions. Great satisfaction is good, but little satisfactions is what keep us going. Do you feel let down by your job, or I'll say by your team or by your agency? A very common thing I used to deal with, a complaint. People would say, "Well, we are getting more and more difficult kids." And I'd say, "Well, that's probably a sign of the times." But then they'd say, "But we haven't changed our staffing." So 30 years ago, actually when I began in child and youth care work, not all, but many of the children were actually neglected. They weren't disturbed. The behavior wasn't terrible. They had been neglected or perhaps abused. And relatively easy to care for because the care level is not so intense. And then things shifted in the field in the 60s, at least in the States. And Not long after that in South Africa, as more and more difficult children came into your care environment, that increased the demands of the job and the stress levels and so on. And the ratio of worker to children had to change. And I know it's still a problem in South Africa and as well as here in the States, that we have, I don't know, a group of 10 teenagers, and you have one person working there on duty. And people would say to me, well, I can't do that. And I would say, that's not your problem. It's made your problem, but that's a management problem. That's a management problem. Your management has not recognized that this is not sufficient. So do you feel let down by your job, by your agency, by your team? Do you doubt your skills and abilities? I'm reminded, again, I love to tell stories. I'm reminded of my brother-in-law, who's now passed away. But my brother-in-law was a senior partner in a law firm. A very wonderful guy, very charitable, very, wonderful person. We were on a camping trip. I had my foster son, and then he was there with his my three nephews. And we're at the campsite. This is in the Quetico wilderness. And I looked down the pathway and I could see this adult and two teenagers. And I could tell from half a mile away, that's not the parent, and those are two disturbed kids. I could tell from the way they were talking and walking and so on. And they came into the campsite and they did everything. They yelled at each other and threw knives and yelled terrible words and so on. And as they're paddling down the river, my conservative lawyer brother-in-law turned to me and said, I have only two things to say to you. Number one, I will never, ever ask you again what you do. And number two, there isn't enough money in the world to pay me to do that job. And that's when I realized I'm talking to you now, we have a tremendous range of skills and abilities. If we begin to doubt those, then there's a problem. Then there's a problem. Because if you doubt your skills and abilities, you're doubting the work that you're going to be doing. Are you this is a big one too. Are you using food, drugs, or alcohol to feel better or to numb how you feel? I got a story for that one too. When I was a young and stupid and green childcare worker, after a very difficult day, I worked in a residential treatment center on the south side of Chicago. After a very bad day, we would go to David's, which is a bar and a restaurant on Halsted Street in Chicago, and we'd have a drink. So one day, after a really bad day, we walked in and the bartender looked at me and he said, "The usual?" And I thought to myself, oh my God, I'm using alcohol. I'm using alcohol to feel better. This isn't right. Do I go and have fat food when I have a tough day, or am I using pot to make it through the day? Am I using food, drugs, or alcohol to feel better or to numb my feelings? Have my sleep habits changed? Now I find at my old age, my sleep habits have certainly changed. Here I am sitting talking to you at 3 o'clock in the morning. I can tell you my sleep habits have changed. But when your sleep habits change, it means the way that your body recharges itself is changing, and not necessarily for the better. So if you don't have enough sleep and you're working in a stressful job, you're going to have trouble. Do you have headaches, stomach or bowel problems, or other physical complaints, but you don't know what the cause is? Especially headaches, it's very common to have headaches. For many years, I had, what do you call those? Really bad headaches. I forget what they're called now. Migraine. I would have migraine headaches where I couldn't tolerate light or sound. I'd have to go I would be in my bedroom in the dark for 2 days. And that came from the job. That was stress. That was stress. So this is not a comprehensive checklist, but it certainly would be something that you could use to determine if you or a coworker might be experiencing a burnout or headed into burnout. Next slide.
Nick, before you go on, there are some questions on that slide. Would you like to take them now or at the end?
Absolutely. Love it. Yeah.
All right. There's a question from Harold. He says, are these examples in combination, or will a prolonged single issue be seen as a sign of burnout? That's the one question. The other one from Richard is that, is it normal to experience any of the burnout checklist symptoms as a result of just having a bad day?
Oh, yes. Well, let me start with Richard's question first. The answer is yes. Any particularly, terrible situation you had to deal with could lead to any one of those. But the question is it ongoing? Is this a consistent experience? We can all think of really bad days we've had when we felt exhausted at the end and couldn't focus and didn't have the energy and didn't know if we wanted to come back to work the next day. We've all had those. Those are transient. Those aren't burnout. Those are stress situations, and we can and should be handling those through self-care. But to answer Richard's question directly, yes, any one of these could be the experience of a particularly difficult day, but that's not burnout. And I'm sorry, let me go back to, was it Harold?
Harold's question, yes, and I can repeat it
Yeah.
for you. It says,
Yes,
are these examples in combination, or will a prolonged single issue be a sign of burnout?
I'm not quite sure I understand the question. So
I think he's saying that you have to have quite a few of them for it to be burnout, or if you have just one of them and it's very, very severe, does it mean you've,
okay.
yes.
Harold, you always ask me tough questions. Yeah, I think the answer is no, that any one of these could be a principal factor in burnout, or almost any combination. It's just that the effect of any one of these, or the combination, if the effect is to produce what we've described already, then yes. Could it be one? Could questioning the value of your work lead to burnout? Yes, it could, if it's intensive and it's happening every day and so on. Individually or together, any of these factors, depending on the intensity and the length, could lead to burnout. And Harold, did I answer your question, Harold?
Well, we can ponder that,
Thank you.
and yeah, and maybe others can add to it. But Nick, there's an interesting comment before we go on to the next slides, is that somebody is saying here, do you feel let down by your job? Question is actually interesting, in that as a child and youth care in South Africa, I feel more that the job is becoming complicated. Yes, we are equipped with the skills and knowledge. However, when it comes to practically applying it, it becomes difficult, as there are various institutions with young children and young people with various medical conditions, and it becomes harder. And just as a follow-up, Zodidi adds, especially when you're working in collaboration with other professionals, you feel delayed and burnout occurs because they feel intimidated that you're stepping into their territory and things are delayed. She adds that, you know, they when I say CC, I mean that I work in a school and I'm the only social worker. Yeah. So basically they're saying that the cooperation and collaboration doesn't work effectively. It's very hard and it causes the frustration.
Well, it's an interesting comment, because I'm old enough that I've lived through the transition of childcare work in the United States and in South Africa, because in both places, originally 30, 40 years ago, the childcare worker was a babysitter. There was no respect for the job whatsoever. It was low demand, low risk. You were just a body that wiped the noses of the children or whatever. And then I believe as the social need for dealing with more troubled and difficult children came to the forefront, and we had to begin to deal with that, slowly, very slowly, respect for childcare work developed. And I think that's still a factor in both of our countries, that childcare workers are not sufficiently honored, shall I say. That contributes to this struggle about value of the job. It isn't until, let me make a side comment also about the other professions, because in that old ancient time back then, there was no respect for childcare work efforts. They were not members of the team, really. There was no team. There was a social worker or a psychologist who told people what to do, and a house mother who, I don't know, did the laundry and took care of the children. And that changed. The more sophisticated the childcare worker and became, and developed the skills, and demanded, not was given, but demanded a place on the team, that began to change. And I have a distinct memory of that change occurring, at least in my state here in the United States, when childcare workers began to say, no, we are team members, and here are the skills that we have, and here's what we can contribute. So that question about satisfaction from the job and the valuing of the job and so on is wrapped up in the historical development of child and youth care work, as well as individual struggle with that. I think I kind of over-answered that one, over-responded.
Mm-hmm.
I don't know. Whoever made the comment, that person could indicate.
Yeah.
Who was, may I ask who was that?
There was Didi and others. If you want to make any comment. There's another interesting question. Again, okay. People can come up to it with it afterwards. It's asked by two people. Richard is asking again, when you burn out, is it normal to ask yourself if you're in the right field of work? Which is interesting because Nisya makes a comment, could the answers to the burnout checklist be indicative of the type of work not being for you versus burnout? Yes, like maybe a person got into the job for other reasons apart from enjoying the work. So I think that's a nice one to take before we move on to the other slides. There are more questions coming, but we can complete more and go back to them.
That is an excellent question, because there were times in my experience when I had to turn to a childcare worker and say, have you considered the fact that this isn't for you? This, you have all the symptoms, all the signs that it's frustrating for you. You're not getting what you want to get out of it. It doesn't look as if you're succeeding at getting out of it. Have you assessed what your needs are and whether or not this job meets your needs? We have needs in our jobs. So the answer to the question is, yeah, burnout could be a sign that you might be in the wrong place. And that's a legitimate question to ask. And it's certainly not, it should not be embarrassing. It is, but it should not be embarrassing for the person to say, you know what, this is not me. On the other hand, I'm sure we all know childcare workers who, the most gifted childcare workers I ever worked with were people who walked in off the street and said, gee, I think I can do this. So there's a certain amount of self-discovery that goes on. To answer Richard's question, I think more directly, the burnout could be a sign you're in the wrong place. You should rethink. I don't know if, Richard, that's what you were looking for, but that's the answer I have for it.
I think that's helpful, Nick. We can move on with the slides and we'll come back to some other questions and comments.
Well, are there more?
Or are there more? Yes. It's about the responsibility for dealing with burnout.
Oh, okay, fine. Let's go to that first. Next. Okay. So responsibility. Now, this is something that I've been thinking about, because usually in the literature, the focus is on the individual. Here's how you know you've burned out, and here's what you did, and here's what you can do, and so on. And I thought, we have to think more systemically about this. Certainly, we have to think about the individual, self-care, that sort of thing. But the individual is embedded in a team, in an agency, in a supervisory process. And I wanted to think about where the responsibilities lie in those different areas. So let's start with, what are the responsibilities of the individual for dealing with burnout? And very simply, it's implementation of a self-care plan. Coming to an assessment that I am experiencing burnout, and the factors that lead to it, and the kinds of things that are complicating my life, but then connecting that to a self-care plan, and then actually doing the self-care plan, not just thinking about it or talking about it. And these all become tied together, because that self-care plan should be something that the individual is discussing with his or her supervisor, because it's part of professional development. The concept of self-care in all the professions, the helping professions, really came in the States anyway, came in the 80s, the early 80s. People saying, all of a sudden saying, you know what, we're not taking very good care of ourselves, we're burning out. So I'm not trying to put the whole burden on the individual or on the supervisor, but actually on both, because the individual might have a difficult time working through a self-care plan because he or she would lack some objectivity. So I connect the self-care plan with supervision. The second is the team. What responsibility does the team have for dealing with burnout? Well, you can't tell the individual what to do, but as team members, you can monitor what others are doing, provide feedback to them, and support the efforts to deal with the burnout. More often than not, team members will dump on others or blame others or have high expectations, and they don't think of their job as supporting each other. The whole concept of team, we use the word team all the time, and I think we don't use it very well. Teams are groups of people who work well together, have common goals, have a tolerance for differences among themselves, support each other. They're characteristics of the high-functioning team that are especially important for our discussion of burnout. So the team has some responsibility through monitoring, feedback, support. The supervisor, now this is a struggle, because I know that we in South Africa, we are working on supervision. It's a focus right now. Am I right about that? Zenny?
Yes.
Yeah. Okay.
Yes.
So for me, or I shouldn't say for me, I think that supervision should involve problem solving, helping the person who improve his or her performance and evaluate his or her performance. It should also involve communication with administration, with frontline workers, and so on. And most important, in my opinion, supervision should include, and principally include, professional development. And so part of that is regular supervision and the development of a professional development plan that includes self-care. So I would bet that many of us are sitting down with our supervisees and saying, let's talk about strengths and weaknesses and that sort of thing. but I wonder how often we're talking with them about how are you taking care of yourself? And not because there's been some incident, but as a regular part of supervision. What is your self-care plan? Tell me how you re-energize yourself. What are you committed, specifically a plan? And finding the agency, and this is the most important in some ways, policy support for self-care. Does the agency value its employees enough that in its policies, it supports the various efforts that would deal with burnout, such as wellness days, personal time, professional development time, performance reviews, all of which contribute to the individual's accurate perception of his or her value and the skills and the abilities and so on. Does the agency structure support for self-care? So these four are the reason why I wanted to talk about this topic today, because I think we spend all of our time talking about the self, what the individual does, and then we should, it's important, but we're neglecting what the team should be doing, what the supervisor should be doing, what the agency should be doing. And I'd like to spend a little bit of time talking about that if we can. Let's see, let's go backward through it. Let's go to the agency first. So wellness days. Now that may sound like a strange thing to you, but I have a story about that one too. So when I was executive director, my frontline childcare worker, some of them came to me and said, you know, we want to support positive planning and health and wellness, and so we would like to do something about sick time, because sick time was being abused. People were calling in sick because they wanted to go to, I don't know, a cross-country skiing event or whatever it was. And I said, fine, come up with a proposal. They came back and said, we propose wellness days. So I earn so many hours a month, what we used to call sick time. Now it's wellness. We'll call them wellness days. And I can use those with advance notice. I can say, next week on Tuesday, I want to have a wellness day so that I can go cross-country skiing. It's part of my wellness plan. Fine, no problem. You could still use it for sick time also if you were sick. The interesting thing to me was that was a staff idea, staff implemented. It addressed the concerns that they had, and it contributed to not only just to wellness, but it contributed to the general tenor, the general, I'm searching for a word, staff satisfaction. Professional development time. Is the agency recognizing the importance of development time, training, I don't know, interning, whatever it may be, because very often the agency looks at staff time as if it's money that it's money the agency is spending. But thinks that staff time should always be spent doing the work directly and not recognizing that this, I'll call it indirect time, professional development time, not only contributes to the job, but it makes the performance more effective, and it improves general tenor and general staff satisfaction levels. And performance reviews. Is the agency looking at a performance review not as the occasion to find out what you're doing wrong, but to find out what it is you're doing right and how the agency can support that and develop that? So those would be some examples, in my opinion, how the agency can, through its policies, support measures to deal with burnout or burn through. I haven't talked about burn through. That's a phrase I invented because what I meant was you're burning through this whole thing. You're not burning out. You're coming through the other end stronger and more capable and so on. Moving on to the supervisor. Well, I talked about that already, because the supervision is often thought of as fault finding. We're going to find out what you're doing wrong and tell you what's wrong. And it's one-sided. It's the supervisor telling the supervisee, here's what you do and here's what you didn't do, and blah, blah, blah. Rather than to say, let's talk together about, let's do problem solving together. Let's figure out what it is that you need. And also, by the way, let's figure out what it is that you have to offer, because one of the things that contributes to positive assessment of one's job and performance is the ability to communicate it to others. So part of in my opinion, part of a professional development plan is how I will take what I have learned and share that and support that with others, especially newer staff members. So I have a role in that. I don't know what else I could say about the team as I move back here in this list, other than monitoring feedback and support. Sounds simple, but I don't think it is. There really has to be a deliberate attempt. There has to be a clear understanding that the members of the team have a responsibility for each other as well as for the children, in monitoring feedback and support. And again, not fault finding, but truly support. Then we come down to the self, and we'll talk a little bit more about self. Zenny, did I do what it was that you were looking for there?
Yes, thank you very much. I think that
Okay.
you have, and I think now we are happy to take hands up for questions and comments as well.
Good.
There are some on the chat box, but I think it'd be nice if you could hear other people's voices now. So could you go ahead? We've got a hand up now. Go ahead. E.g. Don't know who that is. No.
Do I get to see a face?
Yes, you can. You can put on your camera and you can put on your mic, people, please, if you'd like to make a comment.
Please do.
Yes, I'm just trying to look at some of the comments here. Okay. Self-awareness and supervision can help. Margaret made that comment, but she made it even before you spoke, which is actually really good.
Well, Margaret, you can come and do the workshop.
Yeah. Yeah.
I'm serious there. Okay.
Yes.
Sorry.
I think someone is saying as well that there's a hand up. Let's hear from that hand.
Okay.
Go ahead. Unmute, please.
Oh, Gugu. Hi, Gugu.
Hello. Hi, Nick. Good day. I almost said good morning. I just want to point out something. So since last year, I think, Nick, we met at Peter Maritz Children's Home, and we spoke about self-care. So I tried the different methods that we went through. So what I realized is that I was not intentional with my self-care. So I decided to have an alarm at a certain time in the evening so that I can be intentional, because sometimes life just goes fast and then you forget that you're supposed to take time off for yourself. So I think for me, what has worked is just making sure that I do get that time for myself to make sure that I am fresh for the following day. And also, besides support from your supervisor, of which in NACCW, I think we are lucky enough to have supervisors that understand the field. Also, maybe having support outside of the workplace also seemed to work for me. I'm not sure about other people. Sorry about the noise. I'm in school, so learners are up and down.
Well, you make some excellent points, Gugu. One is that whatever the plan is, it's your plan. You can't take something cooked up by somebody else. So you have that alarm idea and so on. It has to be what works for you, and what, in a way, what forces you to follow your own plan. So that alarm is a good idea for you. It might be different for someone else. And you also make another interesting and good point that I haven't made, and that is use of outside resources. In our case in South Africa, NACCW. Now, I've been a member, as Francisco mentioned, I've been a member since 1984. So what is that, 30, 40? Oh, God, it's 40 years. Okay. I found that the professionalization has been an important part of that support for professional development and so on, because now it's not just the workshops, it's the fact that it even exists and it's there and it validates what you're doing and so on. So Google, you make a very good point that the outside resources can and should be part of that. So as you're a supervisor and you're meeting with your supervisee and you're talking about self-care plan, there's nothing wrong with saying, and so which outside workshops do you think you need to have? And, you know, should you be in the what's the upcoming graduation class? NQ, does any help me? NQ, the one that's graduating in April. Anybody know what I'm talking about? Hello?
Say that again, Nick.
Nick? I'm sorry, I saw, where did I see this? Somewhere in NACCW literature. Oh, I saw it in a thing that Mandy Goebel sent out from Durban Children's Home about the group that's graduating in the qualification in April, and NQ something.
I think it's NQF5.
Oh, the NQF level 5.
5. Yeah.
Yes, that's it. Thank you. So there's an example of an external. So Google, you make a very good point about paying attention to external supports also. For me, as a young child care worker, we had just started a child care work association in my state. It was extremely important because it was the only thing that was supporting us outside of the agency. So good point, Google. Thank you. Somebody else, any?
We don't seem to have, Nick, some more hands. It's we've just got some other comments, but I saw Francisco pose a question earlier on. Okay. Francisco, would you want to repeat?
Well, let me see your ugly face, Francisco. I was joking.
Okay, there's a question from Donald. Donald, you may unmute.
Oh, is Donald here?
Yes.
Hey.
Thank you very much, Chair, and thanks very much to Nick for the presentation.
Long time no see, Donald.
Yeah, no, we are very happy that you could make it. You know, managing to connect with us at your time that side. And I want to also say that Zeni lost connectivity. She's trying to get back on, but I also want to make a comment on the point that I commented on as well on the chat box. That I think that many organizations, or what Nick calls agencies, there is very little attention that is provided to caring for staff.
Yes.
Yeah, and as child and youth care workers, we understand the amount of stress that we go through in our work, and it's also because of the situations of children that we deal with. So it's important that we start using our different forums to encourage that the policies around staff wellness be created. I think that the point made by Nick is very helpful, because in the policies that we have, they are mainly developed to ensure that the workers do their work, and there is very little about the employer taking some responsibility, especially when it comes to valuing staff and making sure that they are well. So thank you very much for that point.
It's one of the things I learned as an executive director of an agency or an institution, the time and the effort expended by the agency investing in the staff pays back multiple times, multiple. If the focus is just on productivity of the staff, you're not going to go anywhere. But if your staff are involved, committed, engaged, supported, it's just as an example, and I'm not saying this is the perfect thing to do, but way back when, we implemented a wellness program for the whole agency, the children and the staff, which was interesting. But part of it for the staff was the professional development plan, when the staff member would sit down with supervisor and say, here's what I need for this coming year. I want to do work on, I don't know, crisis intervention skills, and I want to go to this workshop and so on. And when the agency pays it, the institution pays attention to that, the benefit for the agency, not just the individual, but for the agency is tremendous, because it's a positive message. We're there, we support you, we're part of the work. It's tremendously useful for the agency, the institution, to focus on the care plans for the people. And that was a little vague, but thanks for the point, Donald. That was well taken.
Yes,
Nick?
Francisco?
Yeah. Let me just say I agree with that. But before I actually suggest what we also do this side, just a reminder that I think Nick still has 4 slides left. There might be some more tips there. So yeah, we could continue with it. But I needed to add, Nick, that it's a very important point, like Donald says, if the agency gets involved in, promoting wellness of staff and stuff like that. And we started a couple of years ago on this side, where we have staff, we call it staff wellness days and staff wellness programs, like at least once a month. And right, I mean, today, as we're speaking, we have a group of people from Diabetic 101 who comes in and they freely offer their services to do blood checks and finger pricks, and just to speak to people about the kind of challenges that they now visualize as far as your health is concerned. But I have on my board in my office, I got it written down, and it reads, if you view your wellness as chronic medication, you won't miss a dose. And I often remind the staff about that. Because I do agree with what Nick said earlier. If we, in terms of self-care, we take care of ourselves, then we are able to provide for others. But you can't have a sick person at work and expect 100% of that person's input in especially the kind of work that we do. So, I mean, just for the hell of it, that is what we're doing on this side, and our staff seems to enjoy that. But the other important point that Nick does make is the buy-in from everybody. You cannot have one person make that decision and expect that throughout the agency, we're going to have a successful kind of program. If we don't buy in, sometimes we just go for a walk on the beach in the morning for an hour or 2, then come back. But then everybody feels we've been together. Some people actually benefited from the walk. Others were just out to relax. It's those kind of stuff. But there are real pluses in that kind of suggestion. So thanks again for that.
You know me, Francisco, I always have a story. So my story is that one of the things I did in my agency or institution was to implement a total wellness program. And it was proposed by staff and external consultants. But the interesting thing was, when we implemented it, we started with food, the food program. And I said at the time, I want to, when I die, I want to have on my gravestone, he changed the food program at Guardian Angel Home. But the interesting thing for me was we got into it and it was good. It did a lot of good things. But then the staff realized, hey, we're doing a wellness program for the kids. We have to do the same thing.
Right.
We can't have a separate program for the children and for us. And that's when they really began to concentrate on what wellness meant for the staff as well as for the children. Yeah.
Right.
I had this funny image. I have to use a vulgar phrase here, but so somebody was asking me about wellness and the food program. We got rid of refined sugar and junk food and all that kind of stuff. And we improved the quality of food. Somebody asked me once, so why do you have this wellness program? Well, outside my window, it was a playground. And the playground of Arthur, which is 10-year-old African-American kid from Chicago, was on a swing. And Arthur was had ADHD. He was just really hyperactive. And he went off grounds to a school. He wasn't in our on-ground school. And so he was getting sugar. He's swinging on this swing with all this might, and he's screaming at the top of his lungs, I want my fucking sugar. And all I could think of was, there's the reason why we have a wellness program. I'm sorry that I just get distracted by these stories. That whole wellness adventure had a lot to do with what we're talking about today, because it really did improve staff morale, interactions, support, and even the staff empathy for the children and their experiences. It was very powerful. So, thanks, Francisco. Anything else you want to do before we?
No, I think we should maybe just continue with the slides and then see if there's any other questions.
Okay, well, let me mention, by the way, and I said that those of you know me, you've heard me say this, I don't own my program, these slides, so feel free to copy them, take them, do whatever you want with them. I produce these for you, so if you want to take them, use them, do your own workshop, change them, whatever, feel free. All right, next slide. So I want to go back again now to self-care, because here we're talking about an ethical obligation. In our code of ethics, in South Africa for childcare work, we have a responsibility for self. It means maintaining our competence by, taking training and skills and so on, and maintaining that competence through training, education, supervision, experience. But responsibility for self also means maintaining high standards of professional conduct and maintaining physical and emotional well-being. And I bold-faced, underlined, and changed the color of that phrase, because it's very important to pay attention to that. I have an ethical obligation to pay attention to my physical and emotional well-being. It's not just some nice thing I should do. It's something I am obliged to do. By being aware of personal values, their implication on practice, and being aware of myself as a growing and strengthening professional. So there's an ethical dimension, and those of you who know me know I'm a real bear when it comes to talking about ethics and ethical conduct. If I'm not taking care of myself, I am actually acting unethically. It's a thought for you. Next slide. Excuse me. All right. Let's get down to what do you do. Can somebody switch the slide? Thank you. So, excuse me. What do you do? This is the practical stuff. And again, this is not a you must do this list. But here are some good ideas to help you to frame it. Reframe your mindset. Consider the role you've burned out from, and remind yourself why you started. Go back to the roots. Why am I here? Why am I doing this job? What brought me here? And is that keeping me here now? Second, make time for self-care. As Google was saying, she has an alarm that reminds her. Prioritizing adequate amounts of sleep, healthy diet, exercise. I have to, I'm not very good at that. My wife is excellent at that. She goes swimming 3 times a week. She does walking and so on. I'm not quite that disciplined for a lot of reasons, but you have to structure yourself, your self-care. Ask for help. Let your boss, your coworkers, your family members, whoever else know you're exhausted, you're maxed out, you're burned out, you're trying to work on this. Don't think you can do this alone. You can't. You can't. That's how you got in the burnout to begin with, because you thought you could handle it all on your own. Fourth, maintain your social life. Carve out time for friends. Don't wait for more free time. Create it. Reach out. Find new interests. Meet new people. Meet with your friends. Not that I'm a wonderful example of that, but I belong to a group we call ourselves the Old Goats, and we meet 3 times a week at a coffee shop. We have a wonderful time. It's a very open group, and that group is important for my mental health. And finally, set boundaries. When you're not working, leave your work behind. Don't take your work home with you. That's really hard to do. There's a boundary between your work and the rest of your life, and you should maintain that. I'm not talking about rigidity, and I'm not talking about being mean about it, but just be realistic and careful, because it belongs where it belongs. It belongs where the job is, not in your personal life. So that's a good beginning. Now to get really practical, next slide. And again, these are just ideas. This is not, you must do these things. But for example, we talked about this already. Get some physical activity. Go for a walk, as Francisco said. Take a bike ride, participate in a yoga class, anything that does something physical. A lot of the work that we do it's not really physical. It may seem that way because we're working with the children and moving around, but it's really not that physical. It's more mental and emotional than anything else. And we have to have physical activity. I can remember when I had that group of young kids, at the end of the day, I was exhausted, but I hadn't done anything. I hadn't done anything physical. I had to get some physical activity. Engage in a mindfulness activity. Mindfulness means something that you have to focus on. Journaling, exercise, deep breathing exercise, like yoga, or daily gratitude practice. That means paying attention to at least one thing a day that you're grateful for and expressing it. Brighten someone else's day. In other words, look outward, not just to yourself. Give a note of appreciation, gift a coffee or a meal. Just ask somebody else, how's your day? No, I'm fascinated, as I think Francisco mentioned, I'm fascinated by languages, and I'm fascinated by Zulu, because in Zulu, whenever we meet, I always say, "Johnny, how are you doing?" And people expect the response. So ask how somebody else is doing, not just you. Fourth, enjoy activities at home with yourself or your loved ones. Listen to music, watch a movie, cook a meal together, do something with others, not the youth you work with. Reconnect with a friend, phone call, FaceTime, or in person. Yeah, make sure you're getting enough sleep. If you struggle with sleeping well at night, and I do, talk with a sleep expert for ways to improve your sleep habits. It's a struggle that I have, and I really have to work on this. Because the sign of that is I'm talking to you at 4 o'clock in the morning. Set boundaries. Learn to say no. It sounds silly to say that, but the ability to say no, we don't mean saying no to everything all the time. We just mean be realistic. If there's something that you really should say no to. Say no. Ask for help if you need it. Try not to overextend yourself. If necessary, consider leaving or removing yourself from a situation that makes you feel stressed or nervous. There's a good example of something that you can do with team. You could have a team understanding of signals that you can give when it's necessary for you to withdraw from whatever is going on. And your teammates can recognize that and support you and so on. Book a future vacation, even if it's a staycation. I don't know if you use that phrase, but we do. Use your time off to do something you enjoy. Have something to look forward to. Absolutely helps. Strange as it may sound to you, I consider my trips to South Africa to be a vacation, even though I'm working, because it's something I look forward to and it helps me to focus my life. Give back to your community. Find ways to participate in civic engagement. Again, this is looking outward, not just to yourself or even just to your family, but to the broader community. In fact, in some of the programs I've worked with, I've come across public service programs. There was we had a child care worker who worked with I think it was our teenage boys on life-saving kinds of things, like Heimlich maneuver and that sort of thing. And one day the whole group was driving down to the state capitol to do something, and they came across an accident, a multi-person accident. They all jumped down, they did Heimlich maneuver and, the heart massage and did all that sort of thing. You could not imagine what that meant to those young men, to those teenagers, to think that they actually helped people to live because of something that they did. They were giving back to their community. And another instance was we had a flood in the town, and not the same group, but almost the same group, volunteered to go down and pile sandbags along the riverbank to prevent the flooding in the city. Didn't do anything for them, didn't do anything for our agency, but it did for the city. And the pride that they had in doing that was just something to watch. And finally, talk to a mental health professional. There's nothing wrong, shameful, whatever, to say, I think I'm having a mental struggle here. And these are people who have the skills. So these are some suggested activities. Now, you may come up with some others, but you'll notice that most of them have to do with either paying attention to your physical, emotional state, or turning outside of yourself and focusing on others rather than just yourself. So that, I have no graceful way of ending. That's the end. So
thank you very much, Nick. Yeah, thank you very much. I mean, wow, lots of.
My intention when I do these kinds of workshops is not so much to give you a formula or anything like that. It's to stimulate your thinking. It's to say, here, look at this thing. Let's take this and let's turn it a different way and talk about it. And so if that's happened, then from my perspective, I consider it to be successful. So,
thank you so much.
And the last comment I always put a bibliography. I'm a university professor. I always have to have a bibliography. But the one that you have in front of you is just a sampling. There's a huge literature on burnout. These are some things that I thought you might find useful. There's nothing here that's from South Africa that I'm aware of, but I'm sure that there's a literature on this. It wouldn't hurt to do some reading on it. So I put this in here. Sorry, Princess, go ahead, cut you off there.
No, great. Thank you very much. So are there any comments or questions for Nick? I know we've kept you quite for almost 2 hours now.
Oh, that's fine.
And I know that there are some people who are heading off to work again, but just to say, Nick, that we have 90, the indication here is that 96 connections made which means that it's much more than 100 people who are joined, because some of them are sitting in groups or parties in on this on the webinar. There is a hand, and I'm trying to identify who that is. Can you go ahead, please?
Francisco, it's me. It's
Hello,
Merle speaking.
Hi.
Hello.
Oh,
Hello to
Merle.
Nick.
Merle.
And
Hi.
hello there. And I'm so sorry that I didn't make the beginning of the presentation. I had a meeting that ran over at council, but I will go back and listen. And I just really love the stories. I love the idea of that wellness day. And kind of building up points for a wellness day instead of building up points for a sick day. And I just want to say thank you for this, because I think that in South Africa, because we've been struggling as a society for these last kind of 7 or 8 years, I think because our whole society is struggling, we're struggling in all sorts of fields in ways that we didn't before. And I think that it's coming back down to the individual. And I think in a sense, the times that we live in, and hopefully when we go through some elections and our country stabilizes a little bit, and perhaps our economic situation picks up a little bit, we'll be more optimistic. But right now, I think as a country, we're really struggling. And so we as individuals also, I think some of us feel the impact of that. Perhaps I'm speaking for myself, but I speak for my friends as well. And so I think coming back to this topic of actually preventing a sense of kind of hopelessness, which I think many South Africans are feeling at the moment, is really important. So thank you very much.
We could say the same thing about the United States right now.
I wanted to make that point, but I thought it would be impolite.
No, not at all. You're never impolite. Thank you.
Thank you very much, Merle. Thanks.
Yeah, thank you.
Good to see you, Merle.
Thank you.
Is there anyone else who would like to make a comment or ask a question? I see Nokolo says my developmental area is saying no. And I think that's one of the things that hinders my self-care. Someone else. Alfred is saying, are there signs for staff that can lead to them identifying that they are experiencing burnout? Yeah. So there's a couple of slides there that has some response to that. I see.
Looks like Robert, are you wanting to make a comment?
Yes. So
yes.
Good. Please.
And greetings from Zambia. It's good to connect. Thank you very much. I think you have just shared some profound thoughts. What I wanted to ask is, some institutions or organizations tend to deem wellness time as a waste of time.
Yes.
It's as though we are all trained to be working. If you're going to take time out, it's like you're wasting time, is not productive time and all that. Are there any quick ideas you could use to change that kind of mindset, that wellness time is part of work time? It is not a waste of time.
Wellness time is an investment, first of all. And it is possible to demonstrate the positive effects of that investment. So if you just, as you say, working all the time, you're setting people up for burnout. That's a given. You're going to burn people out. If you engage in supportive policies and structures, such as what I did, you can actually demonstrate that the productivity improves because people have more satisfaction, they're well rested, they're trained, they're more effective. If you just have them work, you're just chewing people up. I don't know if I'm answering your question, Robert, but you can actually demonstrate the effects of an investment like that, practically speaking, in the work. But it takes a little bit of time to produce that investment, but it's there. I've seen it. It has tremendous effect. Satisfaction, staff morale, so on. Am I responding to your comment, Robert?
Yeah, I think you are. Thank you. Yeah, it helps.
Okay.
It helps. I like the part that it's an investment. It's not a waste of time.
Yes, it absolutely is. It helped me as a director, as a principal in my institution to think of it that way, because I could see almost immediately, I could see the payoff almost immediately, not just with the staff, saw it with the children too, because as the staff have higher satisfaction, morale, and so on, it immediately is reflected in the children.
Thank you.
Thank you. Fiona, I see your hands up.
Hi, morning everybody. And thank you, yes, Nick, for this lovely conversation around burnout. I just want to say an additional comment is that I think there's this wonderful move in the right direction in the sector because in 2021-22, the Children's Institute started working on some documentation around bringing self-care into the work that is done with child protection workers. And they put a lovely manual together and a resource, and then they piloted it between Pietermaritzburg Children's Home and Durban Children's Home. And we had to do a lot of work, of course, with this pilot. But what was interesting is that it forced us to review a model that was talking to when you are even hosting your meeting with your staff, your agenda needs to bring in self-care. So you do your business of the day well and good, but it included two lovely concepts, well, three altogether. The three concepts were the knowledge, the skills, and the self-care. So nothing goes without each other and always comes together. So every conversation you're having talks to the skills that are coming through or what you're offering or what you're training your staff on, the knowledge that's included in it, but the self-care aspect of it. And in that whole resource, they actually pulled and did research and tried to find the topics around or the resources for self-care. So that's where a lot of the mindfulness and all started coming through, and they actually put us through a program of saying, practice with our staff. Of course, we forget about it after the pilot. I don't think Mandy has focused too much on it either, but it makes me remember the value of it and the need for us to all be more conscientized to bringing this into our everyday work. Thank you.
Fiona, can I see your face?
Hi, how are you?
Oh, there you are. Okay. I don't like talking to a blank screen.
Thanks, Fiona. Thank you. Alfred, I see Alfred's hand is up.
No,
Nick,
took it.
hope you're well. My question is, shouldn't program design include the issues around preventing burnout of staff in the facility? And it doesn't have to be staff coming, but that the program design at the organization includes the issues around what you just highlighted, around creating time, almost like creating barriers for staff to operate within a safe environment. Because I think burnout has also got the aspect of mental health possibilities that staff can suffer from mental health issues as well. Thanks.
Yes. Yeah. Thank you. You're right.
Thanks for your question. Is there anyone else who'd like to make a comment or ask a question to Professor Nick? Zeni's also back now. So I've browsed through the chat box. Is there someone, Crystal Cronje? Are you asking a question? No. There's another hand there. Please ask your question.
That's
Zeni, sorry.
Yes. Can I just ask a question that came up, I think, in the chat, but it's something that is important, I think, as well, is that leadership. So often we have young managers who are growing in their jobs and in their leadership. And, you know, in childcare in South Africa, we are building leaders. But the issue of responsibility for a whole team in programs that are quite complex requires a lot from them. And I think that the burnout at managerial level and the support that is required, I think maybe many of the answers are applicable there as well. But is there anything special you can say to young leadership that are actually striving to build the field and taking on responsibilities that, that are quite commendable?
Well, maybe I just have a comment about that, always leads me to a story. One of my favorite sayings is when I think about the complexity of administration and management and so on, there's a bumper sticker that says, yesterday I couldn't spell administrator, today I are one, which points out that quite often people who are in managerial positions somehow or other were kicked up into it. Somebody ran off and left a blank job and somebody had to fill in. And so many people come into those positions not ready. And that's not a criticism, it's just an observation. But in that job, for myself, I found out that if I started reading the literature on organizational behavior and leadership, that was very helpful. So I think we can't just say to people, well, talk to others and go to workshops. You can do some reading too. There's plenty out there on good leadership. So that's one thing I would promote. And maybe even have a library or a bibliography and so on to help people.
And just to add, I think, we have the opportunity in South Africa where we have different provinces and maybe even district groups where they get together, where they could continue these kind of discussions. I mean, it's definitely something that we need to not just listen to for once, like on one particular day, but it needs to be an ongoing thing. And I agree, with Alfred asking the question or suggesting that in the structures in the organizations, this is one of the things that should be built into staff development. It's part of the plan, like you mentioned earlier on, but everybody needs to buy into it, and you need to ready yourself for it, and not wait until you find yourself in that situation where you are now in a burnout situation, because you're probably going to burn through. Like, it's really being aware that I need to make a plan and be proactive in terms of what I do.
I think that also means that in the structure of the institution, we should be observing those who seem to have a gift or a potential for management or leadership and draw them in. Because most people don't come in and say, I want to be a manager. Somehow or other they wind up there. But recognizing talent and then supporting it and growing people into it could be a very, very useful thing for the person as well as the agency. I have to admit, when I became executive director, I had two really, really good mentors who recognized that that's where I was headed and prepared me. And when I met with other executive directors, they all said, I didn't know what the hell I was doing. They just threw me in there. I knew exactly what I was doing when I became executive director. And I had my mentors to help me out. So we should think about mentoring people and preparing them and developing their skills in the direction of management, if that's where they seem to be going.
And also the ability to identify these kind of strengths.
Yeah.
You know what I mean?
Yeah.
Okay. So
can I come in here? I think it's 12:58. Nick.
I was going to hand over to you. Thank you.
Okay. Yes. I get just a challenge here with my microphone at times. Nick, we did schedule between 11 and 1. I see some people are leaving and some are saying load shedding has kicked in. But there are few comments here, people saying, thank you very much. It was a wonderful and profound topic. Thank you so much. This is a profound and very informative. And there's also, let me just see here. Excellent idea. I think we do too little reading. And then there's just the last question, but we won't be able to manage any other questions at this stage. We will now call on our chairperson from the Gauteng province, Zoleka Mashile, to then do the official vote of thanks to Nick and all our delegates who attended this webinar this afternoon. Zoleka, you may switch on your mic and unmute.
She might be having a problem.
Can we just check? Is she connected? I didn't notice.
I don't see her name.
Yeah. If Zoleka is not here, we'll then just ask Fiona to step in or step up and then just do for us the vote of thanks. Fiona, will you do that for us?
Good afternoon, everybody. It's 1 o'clock. Yes, good afternoon. Yeah, I'll just step in and say I really, really do appreciate, I think, from all of us that have come onto this program to acknowledge Nick for getting up so early and being so patient in listening to us and bearing with us as well. But I think you've always come and shared a lot of good things with us when you've come and done programs and trainings and workshops with us. And we've always grown from the kind of knowledge you have, and especially the practice examples that you share. That brings alive all the theory and all the discussions that we have. So there's a lot of value in listening to your wisdom and your sharing. And I think we all take a little bit of what you've said back to examples that we can reminisce on that are very similar. And even personal reflection is so important for each one of us to go back and do. Because we need to take time individually. I think the question that came out there was, whose responsibility is it to take care of yourself? And again, very clearly, yes, it is a comprehensive thing that should be inclusive of your supervisor and your management team and your employer. But at the same time, it starts with you. You need to know yourself. You need to self-reflect and know when I'm okay and when I'm not okay, and be able to ask for help when I'm not okay. I think those are valuable lessons. A lot of information you've shared is points we can all take and share in our own in-services again when we share the presentation, I'm sure. Take it back and work with your teams in your facilities or wherever you are, and use it as an in-service. Work through it, talk through the symptoms and the important points you shared, so that it's not lost today. It's something that's continued with the conversation with your team. And I'm sure all of us can take that and definitely work with it. And I love the idea that you shared. I think all of us will really review that whole concept about taking a plan and bringing that plan into your everyday program, and working with your team when you are talking self-care as well, not individual and not necessarily only supervisory level with one person, but groups. I like the way you said that it's important to think bigger than yourself and just your supervisor, that it impacts on everybody around if you're not okay and you're not doing the best you can in working with your child. So it definitely impact on everybody in the team. And those are pointers we will definitely grow with and be able to unpack a bit more as well. So I think on behalf of everybody, NACCW for putting together and coordinating this opportunity for us, and Nick for your wonderful time, all the facilitators. Thank you, and thank you to everybody for staying on and bearing. And we know it was a 2-hour session, but you've made the time and committed to being here for it. We're now sitting at 80 at the end of the session, so it's good to see people are still interested, and this is a topic of concern and something that is very close to everybody's heart. And we all want to be sure that we are doing the best we can for the children that we're serving. And the best way to do it is to take care of ourselves, I guess. So thank you, Nick, for reminding us of all these important pointers again today. Great. Thank you, everyone. Alan.
Thanks, Fiona.
Thank you very much. Thanks.
We'll just ask Zeni, maybe if there's any other webinars on the horizon or topics that we would like to share?
If I could just say as well, thank you very much, Nick, again for an inspiring time. And I think people took a lot personally from this webinar back with him. You can see it from the comments, and you getting up early was a real gift to us. Thank you. I just want to say that in terms of the webinar coming up, our next webinar will be Dr. Leon Fulcher, who will also, I think, wake up quite early from New Zealand and will be speaking to us. So that's next on the cards for next month. And I think by next month, we will have a series of other speakers lined up that we will be able to report on. Thank you. Thank you very much.
Yeah, thank you, Zeni, and for announcing that. And we, as requested, will share Nick's presentation with those that attended our webinar today. Thank you very much, Nick, for your time. And I feel like I was in a therapeutic session where I could also attend to my self-care during this 2 hours. So it was also a good part of their development. Yes. Maybe you would like to say a last word before we wave goodbye?
I'll do it very, very quickly. I am honored. I'm always honored to be a part of NACCW and your efforts. And I really appreciate your invitation, and I make myself available anytime in the future to do anything you want me to do.
Thank you. Let's give Nick a big round of applause before we say goodbye. You may use the stuff there to clap hands, those that can. There's some hearts for you, Nick, and hands and everything, all the gifts that we could share with you. Keep well. And we conclude in this session this afternoon, and wish you all well, and see each other next month when we with Leon Fulcher from New Zealand. Bye-bye.
Goodbye.
Bye-bye.
See you soon.
Bye.
Bye. Bye-bye.